Catherine Martin, you have 10 minutes,
Deputy. Ireland's mental health policy, A Vision for Change, was launched in 2006. This document was heralded as innovative, exciting, progressive and inspirational. By positioning the service user at the heart of his or her own recovery journey, it promised a new and modern approach for citizens with mental health difficulties. It offered pathways through which our mental health services could be brought into line with best practice models from around the world. Vision for Change shifted the emphasis from institutionalism to community integration. It promised to offer the most vulnerable citizen a critical ingredient of recovery: hope. He or she could recover their good health and live their lives to the fullest. Our citizens would enjoy equal access to good quality services wherever they lived. The service user would be offered a menu of interventions and supports within his or her community and would be truly integrated into that community. He or she could strive towards living a meaningful life and achieve a true sense of belonging at home as a member of their local community, not in a hospital. Multidisciplinary teams delivering supports to individuals within their community would help destigmatise mental illness. The service user would be met at whatever stage they were on their personal journey to wellness. Embracing the recovery ethos, we looked forward to the modernisation of our mental health services and an increase in accountability, transparency and governance. But in truth, 10 years later, on from its inception, its implementation has been at a snail's pace. It is easy to be cynical. It can be said that it has been a case of more vision than change. This is not a criticism of the authors of this excellent document or the under-resourced health professionals of our depleted health services. But the truth is that the citizens with mental health difficulties and their families have been let down. The light of hope signalled in 2006 has almost completely been extinguished. We in this House must be advocates for the most vulnerable. We must be relentless in our pursuit of their rights to ensure that even within times of financial constraints and pressures, that our priorities are not blinded. The most vulnerable often cannot be an effective voice for themselves. But this should not mean that we ignore them and prioritise other areas for spending. We need to revisit the Vision for Change document and prioritise its full implementation. We need to restore hope. And, Minister, we certainly do not need the shameful retrograde step of 12 million of the budget for mental health services to be rerouted to other areas of the health service. Mental health services should never be seen as an easy target. And when it comes to our young people, we need to think outside the box and be resourceful about how we engage them about their mental health. According to the My World survey, which was a collaboration between Headstrong and UCD, 70% of 12 to 25-year-olds say that with one good adult in their lives, they are connected, self-confident, future-looking and can cope with problems. One action that can be taken quickly is to build on this a reversal of the decision in Budget 2012 to remove the ex-quota guidance allocation in second-level schools. This has led to a reduction of 51.4% in the time allocated to guidance counselling services. Cuts to such services reduce the opportunity for young people to have that crucial, easy access to professionally trained counsellors. The ex-quota guidance provision in second-level schools must be restored. And if the will and commitment is present, the 32nd Dáil has the power. Yes, this House can prove to be instrumental in making a real difference, in saying no more attacks on our most vulnerable citizens. It will be the litmus test for what is now described as new politics. And we should formally embrace at the highest level the evidence-based approach to mental wellness as well as treating mental illness. Some of the most vulnerable are vulnerable by virtue of the fact that they simply do not have the toolbox of skills to cope at a time of crisis. We need to sow the seeds of mental wellness within our families and our schools. The Department of Education and Science and the Department of Health should work together on innovative ways to reduce the incidence of mental illness and in the promotion of happiness and mental resilience amongst our children. According to research, 20% of children show symptoms of anxiety. And a recent survey by IPPN revealed that family issues, neglect and mental health difficulties are proving to be the greatest challenges faced by schools. The same survey indicated that 3 in every 4 principals feel inadequately trained to deal with such problems as they arise. Schools in different parts of the country are doing different things. Roots of Empathy programme, NEPs, PAUSE-B, school completion programmes to name but a few. But what is really required is a more standardised approach where all schools receive the same support and resources and where such excellent initiatives are formally adopted rather than squeezed into a very busy school academic year. School-based counselling is the norm in many countries around the world. We need to explore the feasibility of providing such counsellors in schools and in primary schools in this country too. We need to nip things in the bud. Prevention can be key. Let us lead by effectively showing more passion for prevention as well as supporting comprehensive strategies for treating mental illness. We need to establish research teams, design resilience-building programmes, train teachers and create new posts for specialist teachers in this area. In some secondary schools, we have excellent work taking place with Headstrong and Jigsaw, where vulnerable teenagers are targeted and their psychological needs addressed accordingly. Unfortunately, such programmes are sporadic and not available in every region. These programmes and initiatives must be further developed nationwide and properly funded. We need to consider designing and making similar initiatives available to primary school children. Alongside the full implementation of Vision for Change, we need a vision for sustaining mental wellness. Research is emphatic about the benefits of mindfulness in alleviating symptoms of mental illness. Innovative and overly stretched teachers are teaching its practice in some of our schools. In many countries, it has been integrated within their education system because of its potential to reduce vulnerability to mental illness. In the UK, over 400 secondary schools offer mindfulness meditation programmes. The Department of Education there has designated schools as pioneer schools for mindfulness teaching and have invested over £1 million to help other schools benefit too. A more uniformed and formal approach is key, where we move away from where mindfulness is squeezed into the day through the generosity of a teacher who has sought and paid for his or her own training, to a system that trains all teachers and supports all schools. Our young people's sense of well-being should be at the heart of education. Ní hagan an óga figo, agus ní mórdún civnú go rud lo cailach inchin fósta, inchin dégora, agus tá dúlgás orin suki canolta a cohu. Enough time with its lethal consequences has been lost. Too many years now where mental health has continued to be the Cinderella of our nation's health service. This is fundamentally a crucial test for society through its politics. We must not be sidelined or sidetracked into narrow party political concerns. And this makes the current delay of 60 days and more in forming a government all the more shameful. The soon-to-be Taoiseach and his government, if the will is there, can place mental well-being on the top of new politics. If the political will is there, it is easily achievable to lead effectively from the front and insist on the implementation of real positive changes to our mental health services. Mental health must be a priority of the next government. No more delays. In the words of Benjamin Franklin, "You may delay, but time will not, and lost time is never found again."
Thank you.